Thank you for joining us today for our webinar, Run Your Next Mile, Safely Increasing Your Mileage and Returning to Running. My name is Annette Eckel, and I'm the meeting coordinator for Longevity Physical Therapy, which has 3 locations in San Diego County. Longevity Physical Therapy is a team of compassionate individuals looking to help you move and live better by addressing your movement challenges, providing excellent and individualized physical therapy. We strive to deliver clear and concise health information to help you live your best in 2022. As a reminder, the information shared today is not to be used as a substitute for professional diagnosis, treatment, or advice. Always seek the guidance of your physician with any questions you may have regarding your health and conditions. We'll be saving a 15-minute Q&A at the end to answer any questions. During the webinar, you may put them in the chat box and we can address them at that time. Please join me in welcoming our speakers, Rachel Oakley, Doctor of Physical Therapy, and Orthopedic Surgeon, Dr. Erin Farrelly. Rachel Oakley is a doctor of physical therapy and the assistant clinic director in our Blessing Ranch location. While in college at San Diego State University, Rachel competed in both cross country and track. As an avid runner and 3-time Boston Marathon qualifier, she is passionate about finding the primary cause of her patients' injuries to prevent future recurrence. She also strives to guide them through their rehab so they can run even better than before. Dr. Erin Farrelly is an orthopedic surgeon with a subspecialty in orthopedic trauma and treatment for complex fractures. She is part of a team that treats patients after traumatic injuries, such as motor vehicle and motorcycle accidents, falls, and sports injuries. Dr. Farrelly is also dedicated to preventing and treating overuse injuries, having run Division I cross country and 28 marathons, including 7 Boston marathons. Wow. She understands how important sports are to people. She is dedicated to help her patients return to the activities that are most important to them. And now Rachel and Erin will be presenting Run Your Next Mile, Safely Increasing Your Mileage and Returning to Running. Okay.
Annette, can you let me co-host me real quick? And then we'll get started. Thank you. All righty. Hello, everybody. Annette, just a quick check. Can you see my PowerPoint? Awesome. That's my mom. Hello, everybody. Thank you so much for joining us today. We are here in our Blessing Ranch clinic at Longevity Physical Therapy. Like Annette just introduced us, I am PT Rachel Oakley.
Good morning. I'm Erin Farrelly. I'm an orthopedic surgeon.
Perfect, perfect. And we are so excited that everyone is joining us today. Thank you so much. Just before we begin, we would like to again put out a disclosure agreement that if you are undergoing any sort of injury, please go see a doctor or a PT. This webinar is not intended for specific medical advice, okay? All right, so as we get started here, we'll just introduce our topics. The title is Run Your Next Mile. This is a part 2 series on the first one that I did about a year ago called Run Your Mile. So I'm super excited to have Dr. Farrelly here with us, and we're going to be talking about safely increasing mileage and returning to running. This is just a little overview of what we'll be presenting on today. We're going to go over a super common running injury, the stress fracture, and it really coincides with what we're going to be talking about today with increasing your mileage. We'll then go over some prevention and treatment for those stress fractures, then jump into that safely increasing your mileage and throw you up some running resources at the end. Okay, just real quick though, I'll just start with myself so I don't have to follow your 28 marathons, but I am, like I said, PT Rachel Oakley. I ran at San Diego State, like Annette mentioned. I've done 6 marathons, 12 half marathons, 1 Boston, but qualified 3 times. But the caveat is that I haven't run a marathon since February of 2020. So it's been a minute since we've been back into it, which is why we really wanted to speak to you guys on this topic, because we are right in the middle of going through getting back to our own running journeys and increasing our own running mileage.
Good morning. I also ran in college, and I had so many injuries in college that I actually swore I wasn't going to run again after college, and ended up doing a marathon shortly afterwards and got hooked and was able to do 28 marathons without a single injury. So it just shows that if you progressively increase and incorporate rest, it is possible to train for really long runs without having injuries. I just ran my first marathon in 6 years. My daughter's 5.5, so you might be able to figure out the timing on that one in January. And Rachel and I have both noticed in talking to runners that a lot of people have had their training get thrown off because of everything that's been going on in the last 2 years. So we're hoping that we can help you to get back to what you want to do safely.
Very good. Alrighty, overarching theme here before we kind of get down to it, we really wanted to speak to you guys about our running philosophy. This is something that both Dr. Farrelly and I really stand by. There's a lot of people out there, a lot of doctors, a lot of people in the healthcare community that really talk about how running is bad for you. We're here to tell you that running is not bad for you. It actually can be very good for you. The thing where it gets more into the bad section is if you're running incorrectly. Incorrectly can be defined in a few different ways. So we can, running incorrectly could just be poor form, and you're toppling all of this poor form on many steps throughout your runs, and that could really lead to some problems in the body. Another incorrectly terminology would be kind of under the quantification of not having enough strength, endurance, stability, or even balance in those legs of all of those muscles that are really trying to support you while you're running, and that can lead to some serious injuries as well. So with that being said, there is a safe way to return to running or increase your mileage. So more returning to running after an injury or increasing your mileage from where you currently are. There is a safe way to do that, and we will definitely talk about that during our presentation today. However, I do want to mention that running schedules should be unique to each person. There isn't like one beautiful blanket statement recipe to throw at every single runner. And there's a lot of different caveats to that. So we will definitely help you work through that today. But for a really unique and personal running program to you, it does depend on where you're at, injuries, lots of different things. So that would be if you wanted something tailored to you to really be talk to a professional like we talked about at the beginning.
So I 100% agree with everything that Rachel said. And not only is running not bad for you, but if it's done correctly, it can actually be very good for you. Most people are aware of the cardiovascular benefits. Runners actually have a 3-year increased life expectancy compared to the general population. If running is done correctly with the right balance with nutrition and not overtraining, runners tend to have a higher bone density and decreased fractures, and that decreases the risk of hip fractures, which can be a really devastating injury later in life. A lot of you have probably been told, if you mentioned to your friends that you're a runner, that running is bad for your knees. There's actually no evidence to back that up. Runner's knee is fairly common, but that's something that's very treatable by our physical therapy colleagues, and it does not have a long-term prognostic problem for the knees. In fact, runners are 50% less likely to have a total knee replacement than the general population, and they're also less likely to have total hip replacements. And it's believed that that's because running increases all of the good biochemical things that are within your joints, things like glycosaminoglycanides.
Okay, very good. On to the next one here. Alrighty, we wanted to go into a very common running injury called a stress fracture. You'll hear about these all the time in our running community, and it really goes along with our topic today. So we're gonna dive right on in. So the first thing, what is a stress fracture? And it is an overuse injury that presents as a tiny crack in the bone. This is really more in the repetitive category. It's not, you hear about fractures in more of a traumatic sense. So there is an incident, a fall, something like that, where you break a bone or you fracture a bone. It is not that. It's more of a kind of sneaks up on you over time and really can put some damage into the bone. It is very multifactorial, meaning it comes from a bunch of different causes. However, a very common cause is, especially in the running population, is that your muscles just overall become fatigued. When they become fatigued, they're unable to absorb that shock, that impact from the ground, and that can really lead to stress overload to the bone. This commonly occurs in runners because we're increasing running volume, usually too quickly, too many days a week, or too intensely with speed as well. So you're going to hear us talk a lot today about shock absorption into the bone. That's where those muscles really have to work well for you, or else that bone is just not willing to take on that much stress. Sometimes too, I wanted to mention real quick that these can start out as what was more called like a stress reaction. So it's kind of more of the inkling before the actual tiny crack appears in the bone. And that is super important to get diagnosed early and go and get checked out, because that can develop into a stress fracture. And I've seen it with a lot of my teammates, unfortunately, in college. Which brings me to my next point. Stress fractures are 21% of all injuries, running injuries, excuse me. That is a pretty high percentage. and they're commonly in the lower leg. With my slides later today, I'm going to be talking a lot about more of like the lower leg type stress fractures. So the ones in the tibia, the metatarsal bones, which is your toe bones, more in like the fibula, the other side of the shin bone, and then tarsal navicular, another bone in your foot. Less commonly up the chain in runners, but Dr. Farrelly is going to talk about some really good stuff towards the hip. So yeah, that's more of the stats on those. Okay, so first things first, if I have a patient that comes in that has a stress fracture, this is their likely clinical presentation. They'll usually tell me like, yeah, I'm a repetitive athlete. I'm a runner. I have been running for a while and it's like my foot or my shin or whatever has been hurting a little bit, but not that bad. And now all of a sudden it hurts really bad. And I didn't fall or anything. I don't know what's going on. And then usually they'll have pain very specific to where their stress fracture is. So if it's in that tibia, they can point right to the bone where it's bothering them. They might have some swelling without bruising that's really local to the area as well. And they also could have some night pain. So when they lay down at night, they can really feel that spot. It's usually like a dull ache pretty deep into the bone, pretty localized to that area as well. And they'll usually tell me, yeah, it hurts when I start running and it like kind of slowly dissipates a little bit when I like unweight my leg or like put it up for icing or whatnot. But it doesn't usually completely go away, especially when it gets pretty severe. However, the research shows that this obviously does not RICE. So everyone's heard the term RICE. Rest, ice, compression, and elevation, that doesn't significantly improve the stress fracture because it may feel good at the time, but it doesn't do anything about actually repairing the bone. So all in all, what I wanted to illustrate with this slide is that when a patient comes in and I see any of these red kind of flags coming up, I'm immediately looking for any sort of bone damage, a stress fracture in this regard. And if I suspect this at all, I am sending them right back to the doctor's office because I need to make sure that this stress fracture has been formally diagnosed. And then before we can even move with a lot of different PT interventions. So that's where the PTs to the medical community really comes in handy with that one.
So as Rachel mentioned, the key to stress fractures is really early diagnosis. So I would really recommend that you go in and see somebody. Best case scenario, we tell you it's not a stress fracture, but if a stress fracture is missed, it can really have lifelong consequences if it goes on for too long. And the sooner that you pick it up and address it, the faster it'll get better and you can get back to running. As Rachel said, there are some really classic symptoms and physical exam signs for a stress fracture. So a lot of times we can tell pretty quickly whether or not that's what it is. A lot of times we'll confirm that. An X-ray tends to lag behind for weeks. So a lot of times it won't show up on an X-ray right away. Sometimes we'll confirm it with an MRI. Sometimes we don't even need that because the exam is so classic for what it is. But the early diagnosis is really key. And in particular for young patients, for teenagers and patients in their 20s, if they're having patients in their knee, that's something you want to get evaluated as soon as possible. Deadly things like cancer can be mistaken for running injuries. So you just want to make sure you get it checked out. That's very, very uncommon, but it's just worth the visit. There are some signs of overtraining that could alert you that you are doing things that could put you at risk for a stress fracture. And that's a good time to evaluate your training and maybe even get some help from a coach so that you don't actually develop a stress fracture. If you're overtraining, your immune system gets weakened and you'll be more prone to things like colds. You might not be sleeping well. A lot of people will get irritable and anxious or even so far as clinically depressed. So if you notice any of these things, maybe have your training program checked out before you get hurt. In terms of treatment of stress fractures, basically stress fractures fall into two big categories. One is low risk and one is high risk. For low risk stress fractures, the treatment is usually just avoiding the thing that caused it in the first place. So unfortunately, a lot of times that does mean a period without running, but we'll try and make the most of that period and get you into physical therapy so that you can address the things that put you at risk for that stress fracture in the first place, so that not only can you heal that one, but you'll be less likely to get one in the future. There are also some other things that we can throw at it to try and get it to heal more quickly and decrease your risk of future fractures, things like getting nutrition involved or just improving your own nutrition. There are a few other things that we can do. Sometimes it involves casting or non-weight bearing. The fractures that we worry about more are the high risk stress fractures, and those are the much less common types of stress fractures, but those are the ones that if you miss them can really cause big problems. The biggest one being a femoral neck fracture. If a femoral neck stress fracture goes to a complete fracture, people can end up with what's called avascular necrosis, and they may need a total hip, but very young in life. So we want to catch those early so that that doesn't happen. For high risk fractures, a lot of times we will talk about the option of surgery. Very rare that you have to have surgery for a stress fracture. So this is very much a shared decision making between the patient and the doctor. Typically, the recommendation for surgery was classically what was referred to as the high level athlete, but that doesn't necessarily need to be the case. If it's just going to interfere with your life a lot to be non-weight bearing, the risks of surgery may outweigh the benefits of surgery may outweigh the risks. So that's something that we would talk about in a lot of detail in the office. We have a couple of case examples of high risk fractures to explain what, give you a better idea of what that means. So this was a young lady who's 31 years old who actually didn't present to the office. She was a nurse who was limping around the hospital. She had just run a half marathon recently. She was in very good shape. She'd run marathons in the past, but she hadn't been able to train the way that she usually did because she had a 6-month-old. So it took a bit of convincing, but she was finally willing to pop into one of the exam rooms, and she had physical exam findings that were classic for a femoral neck stress fracture. And that was confirmed with an MRI. So we talked a lot about her options. Initially, she wanted to try non-operative. As medical professionals, we know everything that can go wrong, so surgery doesn't sound terribly exciting. But she tried using crutches for a couple of weeks, and her 6-month-old was at the stage where she really needed to be picked up, and she wasn't able to do that. As a nurse, she wasn't able to do her work. So she did end up opting to have surgery. It was a couple of months before she was back at work, but ultimately she returned to her job, and now she's safely training for her next marathon. Tibial stress fractures are less common in runners, but this patient was actually a basketball player. She had just graduated college and missing her teammates, essentially decided to start training for a marathon. And because she was in such great shape, she was able to start with a lot of miles in the beginning. And she started having pain in a very focal spot in her shin, and x-rays confirmed what's called the dreaded black line, which is a tibial stress fracture in an area that's very, very prone to non-union. So there are basically two options for that. You can try and treat it non-operatively, but sometimes that can mean non-weight bearing for as long as 8 months or a year, or you can try surgery. She ultimately opted for surgery because the thought of being non-weight bearing essentially sent her into a depression immediately. So she had surgery and she did very well, and she was able to get back to everything that she wanted to. And the final case is a 23-year-old young man who was very active. He had played soccer at a relatively high level, and he had just joined the Army. And in trying to get ready for basic training, he started increasing his miles, and he realized that he actually really loved running and was very good at it. He placed second, and I believe it was his first 10K, and started training for a marathon. And he was playing handball with his friends, and he landed awkwardly on his foot, and he felt a crack. And when you talk to him more, he had actually had prodromal symptoms. So he had been having some aching pain in that foot, but had been running through it. On physical exam, he had a high arch and he had very focal tenderness, and his x-ray confirmed that he had what's called a Jones fracture, which is a fracture of the 5th metatarsal. It's in an area called the watershed area, which means that the blood supply is basically coming from 2 directions. And in that spot, it's at its weakest point. So his treatment options for that were either to try non-operative and non-weight bearing and hope that it healed, or we could fix it through an incision that's about 1 centimeter big, and we put a screw inside the bone and then progressively return to activity as his pain improved. So he opted for surgery, partly because he was really eager to resume his training because he really wanted to join the Army. And he was back to painless training 8 weeks later, and he went to basic training about 8 months later. There are special populations that are at higher risk for stress fractures, and those were illustrated by these cases. Patients that are pregnant or recently postpartum are at higher risk for a couple of reasons. One is that there's a high nutritional demand, so sometimes people aren't able to increase their calories enough. And a lot of calcium and vitamin D is used up in breastfeeding. Most of us should be taking calcium and vitamin D supplementation anyway, but particularly anyone who's breastfeeding. Pregnancy also can change the biomechanics. A lot of people will have what's called diastasis, which is when the abdominal muscles are separated, and that can change their gait. A lot of people will develop some gluteus medius weakness during pregnancy. And these are all things that can be addressed so that you don't develop a stress fracture. That could be with formal physical therapy. There are physical therapists that are specially trained in this. There's also a couple of really good online programs that I'd be happy to share with people that help people transition back to running safely. Patients that are coming back from orthopedic surgery can be at risk. A lot of times that's because they were at a very high level before their surgery and they're really eager to get back and they try to jump back at the same level and end up injuring something else. Or it can be because their biomechanics changed because they were either having pain or their pain changed to a different location. So working with physical therapy can really help to prevent those stress fractures. And then military recruits and patients that are changing sports are essentially the poster children for stress fractures. And the reason for that is that they're in such great shape that they're able to get to a very high level of miles in very quickly. And their body's just not used to that kind of pounding and they can end up with a stress fracture and that can set them back by quite a bit. But there are ways to prevent that. The biggest one being starting very early. So if you're starting to talk to a recruiter, that's the time to start running. And then you have plenty of time to progressively increase. The recruiting takes a bit of time typically. So you have plenty of time to increase your miles before you actually go away to basic training. In terms of running, the earlier you start and slowly progress your miles and slowly progress your intense training, the safer it is. For marathon running, I would really recommend that you take 6 months up to a year to train for that race. You're less likely to get injured.
Very good.
So our goal is to identify the thing that caused the stress fracture in the first place so that you'll be able to come back more safely and not have any in the future.
Perfect, perfect. So Dr. Farrelly kind of defined a lot of those risk factors. As a PT, I have a few that I'm looking for too. I'm going to ask a lot of questions about the running surface that you are running on. If it is more of that concrete type running surface that is a little bit higher impact, just something to keep in mind, rather than like a softer trail. Or in our immediate area, there's a lot of hills. So kind of that running downhill really puts a lot of stress to the bone. If you don't really have the muscular support or stability to endure that for the entire duration of your run, that's really going to cause some problems to your bone. I get so many of my patients that tell me their running shoes are like 5 years old, and we need to make sure that I'll talk about shoes in just a moment, but we really need to make sure that we're really switching those out at recommended dosage, or else we're just going to tear through those shoes and more of the stress and everything of the impact from running is going to go to our bones. All these things I'll talk about further is just decrease like flexibility, strength, stability, or even endurance in any of our muscles around the area that we have gotten the stress fracture is super important to look at. And then of course, improper running form, which I'll dive deeper in next. But I wanted to highlight with this slide too, that we both are looking at that, that rapid increase in repetitive activity or that training load or overuse. That is something that we're asking our patients like, hey, how long did it take you to ramp up? What did your training look like? That kind of stuff, because that could be a pretty big sign of developing a stress fracture. Okay, so into shoes. So yeah, like I said, I have a lot of people that have had the same pair of shoes forever and ever, and I'll take a look at the bottom of them and it's like basically no sole left and they're just like completely worn through. So there is of course a lot of dispute in the research about shoes. In general, though, there has been a pretty good push in the research about comfort. So if you found a pair of shoes that works for you, and that's something that you have been working and running with for a long time, that's likely going to be pretty good for you, according to the research. However, even though you have that pair of shoes, you really need to switch them up every 3 to 6 months or 300 to 500 miles, kind of whatever comes first, depending on what you're training for as well. But that's more of the generalized guidelines. I also recommend getting any sort of like orthotics or inserts. The ones that come with the shoes aren't necessarily greatest for absorbing impact of running. So there is some other options. I do want to put the caveat on this though, that you should really, instead of going out and buying your own and trying to figure it out yourself, you should really try to get your foot evaluated by a PT or someone that knows foot structure and can recommend the type of insert to use for you. There's also some really good custom options out there. In the clinic, we have the Power Step, which are those blue ones kind of on the middle of the screen under the Brooks logo. Those are pretty good. I run in those right now, but they are pretty like rigid on the arch support. So you just need to make sure that your foot can take on that force and that you're not going to throw yourself into another situation of injury or pain while running while you're in those. Okay, so 3 kind of main categories for the quote unquote running shoes that I get asked about a lot in the clinic. I'm gonna gear this a little bit more towards the stress fractures, but there is different benefits to each of these types of shoes. The Hokas are something that's really come up. I remember they first came out when I was in college, and they were more like a trail running shoe, but a lot of people have been using them for daily walking, and they've done really good things for different foot and lower leg ailments. They have a ton of cushion. They're really thick on the bottom, so they have a ton of cushion. So that has been proven to reduce the incidence of a tibial stress fracture, specifically in a lot of the research, because it does absorb a little bit of that shock. And then even another benefit to them is, even though they're pretty large and like on the sole of the foot of the shoe, and you can't really feel the ground underneath you so much, they do have some really good benefits on how they control ankle mechanics, so that you can kind of get away with not feeling the ground so perfectly. And even though they're a little bit larger, they don't really have a change in your running economy or running kinetic variables, we call them. So it doesn't really slow you down too much, even though it's a bit of a bulkier shoe. The next one is like that kind of that mid-tier category, still have a pretty good amount of cushion to them. These are anything that's like a running shoe. So Asics, Brook, Mizuno, even New Balance are a lot of these shoes. I'm an Asics Cumulus person till probably the day I stopped running. I love those. Asics are just great. And then these versus like a lower cushioning shoe just have better shock absorption overall. So that's really going to help you on some of that impact for running. They're a little bit lighter than like the heavier shoes. So they do have some research showing that they can improve your performance comparative to a larger shoe. So that would all be, of course, depends. However, these ones, unlike the Hokas, they have like the Hokas, they have a little bit like more of a challenge on feeling the turf or the trail underneath you. And they don't really have that same ability to guide your foot as the Hokas have shown to be. So it can be a little bit like that, but if it's something that you're used to and you know how to train yourself up and you have pretty good ankle stability, these are a really great shoe for you. And then the minimalist shoes. So these are the pretty, like the Nike Freeze, even like more of Adidas, like gym type shoes. And then those finger shoes that everyone likes to wear sometimes, even more of like the barefoot running population. Like there's some that basically have no support under the bottom. It's like you're wearing nothing. These of course are really great in terms of they're fast, they're slick, like you can, you're not carrying a lot of weight on your feet. So it does show some improvements in running performance. However, and a lot of people have, especially with the barefoot phenomenon, a lot of people have studied these in relative to decreased knee injuries. However, there needs to be more research on this, because it's likely that decreased knee injuries are occurring in some way, shape, or form because of the increased foot and ankle injuries. So if you're someone prone to stress fractures, stress reactions, or have a history of them, I'm not recommending these types of shoes for you, just because there's just not enough shock absorption in them. Okay, so this is the patient now. They've gone to the doctor's office, they've gotten the diagnosis of a stress fracture, it's been cleared as stable and for them to return to PT. Or even there's some stuff like Dr. Farrelly was saying that we can do before, like loading is really able to be done. But this is more of like when loading is able to be done is what the typical PT exam would look like. I'm going to focus more on like that lower leg, that foot type of situation, because that's where I see most of mine patients coming in with these types of stress fractures. So a lot of things that could be causes of these from a PT kind of mechanical and musculoskeletal capacity is having those lower leg muscles that are either tight, weak, fatigued, poor endurance, poor ankle stability, poor ankle control, stuff like that. And then where it really affects your ability to load into your joints of your lower leg, even in through your hip, knee, ankle, foot, no matter what it is. So I'm going to be taking a look at all of that. Another thing too, I'm always looking at ankle mobility. My runners usually have super tight calves or super tight soleus muscles more so, but either way, you're going to really disturb your ability of your ankle to bend back, and that's going to increase some shock and put some stress on nearby areas, which is why some of those other areas nearby the ankle joint are pretty common for stress fractures. Another thing, we talked about old running shoes, but another thing is overtraining. So that's something that, again, like a risk factor we're really looking into, is just seeing like what your mileage and everything and how you ramped up. That's always something I'm asking about. In terms of an objective exam, I'm going to do what I call palpation, which is kind of just poke around a little bit at different sites. I'm going to see how irritable that site of the stress fracture is, to see how you're feeling. I'm also going to be looking around, see if there's any of those tight muscles around the stress fracture that are just not working right for you or pretty limited in their flexibility. And then a big one that I do with pretty much all of my runners, is I take a look at what is called TZ1 ankle joint mobility. So that is in the bottom left. I'm checking out, my husband has the tightest ankles in the world, so that was a good one to evaluate for him. But basically, I'm checking out to see how well do your joints move in your ankle to accept the weight of your body as you're stepping into your foot as you're running. So how well does it dorsiflex, bend backwards? How well does the calcaneus, your heel bone, evert? How well does your foot kind of go into the ground? I'm checking all of those things. How well does your tibial internal rotation, or is something really, really stuck? And more oftentimes than not in my runners, I find what we call talocrural joint posterior glide hypomobility, which means that the talus, which is a bone underneath your tibia, does not glide backwards properly. So that's something that we're definitely addressing, because that can really lock up your ankle and send shock to nearby areas. I'm always looking at flexibility too in my runners. Like I said before, I see really tight calves, plantar flexors, really tight hip flexors, quads, IT bands. Usually everything's tight on the lower leg. It's something that we really got to address. I'm looking at, I have a few go-tos, but of course it would depend on what you're presenting to me, but I love doing a single leg sit to stand test. And I find a lot of times in my runners that they're not really able to do a lot of single leg squats in a row, which is definitely problematic in terms of not having enough muscular support and endurance to stabilize you while you're running. And along with stability, I'm looking at your stability on one leg. A lot of my runners come in and they really dislike doing balance exercises, but they really, really, really need it, especially poor ankle stability and poor hip stability, poor glute control, like Dr. Farrelly was mentioning earlier, is super important to be able to guide you through your run and keep you safe while you're running. So we're definitely going to be looking at that and then training that up if we need to. And then I go into a running movement analysis, which I believe is the next slide. Yes. Okay. My favorite thing ever. So if clear to do so, if the stress fracture isn't irritable, if that kind of stuff, if we're ready to run again, definitely taking a look at your running form. I have some great apps. On Form is my new favorite. That really essentially maps your joint alignment and your angles while you're running. And then I can take screenshots at specific times that I really want to look at. For example, I was talking about those transitional zones 1 and 2. So on the far left photo, this is me in transitional zone 1, which means my right leg is going to accept my weight. And what does my lower leg, trunk, everything look like while I'm doing that? I'm going to take a look at that. I'm going to take a look at what I am very guilty of is overstriding. Something I'm working on a lot with my running gait right now is overstriding is exactly what I'm showing you in that far left photo. My heel is landing outside of my center of mass, and it's like way in front of that yellow vertical line that you see in that photo. What that can do is increase a lot of stress, a lot of shear force up the leg, and really lead to it's a risk factor for stress fractures and stress reactions. Another thing too I'm looking at from this angle is vertical displacement. So sometimes it's called ponytail sign. How much is your ponytail bopping up and down? If you're having a lot of vertical displacement while you're running, there's parameters I can measure for that. Then you're essentially, like, if you're a pretty bouncy runner, you're just coming down on those joints every time you run. So that could be a lot of impact that maybe your muscles aren't equipped to handle, and that can put a lot of stress into the bone. From the posterior view, I made my student here run in a Hawaiian shirt one day. He did pretty well, but with that, I'm mostly looking at foot angle and foot angle progression from this side. If you have a pretty rigid foot, pes cavus, or everyone's heard of the term supinated, usually in the running population, if you have a pretty supinated foot, I can see how your foot accepts weight from this view. And if it stays pretty supinated, that means it's not really absorbing shock very well. And that can send a lot of stress up the chain as well. And it's something definitely to look at. Otherwise, from the back, I'm looking more at like knee control. Pelvic drop is a big indicator of glute weakness or lack of glute neuromuscular control in a single leg standpoint. And that can cause the knees to knock together, or even what we call like a crossover gait. So your legs can be coming in like this and almost crossing over each other. That would all be something that I would definitely want to train in the clinic, whether that be different balance exercises or different really good glute neuromuscular control exercises. So into some exercises that I really recommend. So we're definitely, like I said, I have yet to meet a runner that doesn't have tight calves. So including myself. So we're really going to work on that. Probably likely going to throw in a really good flexibility program for a lot of my runners, hip flexors, IT band, that kind of stuff. Quads usually need a lot of flexibility work as well. But the calves, more specifically for the lower leg, kind of stress fracture presentation. That ankle mobility I was talking about earlier with that talus not gliding backwards, which is what I always evaluate in that transitional zone 1. It's usually problematic. So I'm going to go after this second photo right here. This is a really good way to help this out at home. I give this to a lot of my runners, do this myself. It's a way to essentially reproduce the glide that I'm doing in the clinic to really help your ankle load at home. So it's a really good one to do at home. I also have like a running series. I stole this from one of my coworkers and rebranded it as the running series, but basically it's a lot of glute band exercises. It's that third photo with the blue band over there. It's a lot of, I use it a lot for glute activation. I use it before any of my strength workouts to make sure my glutes are firing properly and make sure I'm loading properly and through the hips, down the legs. But there's some really good endurance things that we can add to that. We can end up doing 75, 100 reps of that in a row, and that's going to be a really good training exercise for you. Even more of a bonus if you're able to do something like that on an unstable surface, a BOSU, a foam pad, anything like that really adds to the stability component. If I did find like a little bit of a weakness on one side, we definitely want to strengthen you on one single leg and not just teaching you how to use both legs to make up for the lack of strength in one, because as you're running, you are asking yourself to control your whole body weight on one leg at a time. That's what running is. It's kind of jumping from one foot to the next. So if you don't have the strength in one leg, it's really going to cause some problems with definitely some injuries. But I always want to do a lot of things in 3 directions. So that's what that video was showing you earlier about some balance. Here I'm showing a very awesome balance exercise. We call it a balance reach, and we're going to go in all 3 planes of motion just so I can see how your stability is on one leg. And I'm definitely, even though the running essentially is forward and backwards, I'm still going to look at all 3 planes because it still gives me a lot of indication on how your stability is. And then core. Everyone doesn't like core, but I make all my runners do core because it's super important to be able to just control. It just helps overall control of your body. It can really help with the balance down in the lower leg region as well. All right. There we go. Okay, now we're going to get into safely increasing our mileage. I didn't skip a slide, did I? Nope. Okay, good. So a lot of research has been going on about this, a lot of opinion pieces out there. So I try to compile it the best I could for everybody, but short answer is it depends. It really depends on the person. Overall, the one that's been most adopted in the running community is what we call the 10% rule. And it's basically stating that each week you really shouldn't increase your running mileage nor your long run mileage by more than 30%. And likely, ideally, you want to stay in that 10 to 15% mileage increase. So if you do the math, you're running 10 miles one week, you don't want to increase by more than that the following week. However, this is not applied to every single runner out there. So how I like to think about it is more of like a beginner, intermediate, and advanced type runner. And beginner kid is not only someone new to running, it's someone that's recovering from an injury and getting back into running. You are essentially, unfortunately, we got to go through the beginner running stage, at least initially. However, if you do have a long history of running, you can likely get out of that stage pretty quickly. So as a beginner, you really, really, really want to make sure that you're staying consistent over about a month. And the generalized recommendations is 1 to 4 miles, 2 to 3 days per week, and for 3 to 4 weeks before you even touch any of the progression, any of the 10% rule. Before you do that, you want to get really consistent and have the body feel really good for about a month. If you're more in that intermediate or you're ready to advance out of beginner, then you can start adopting more of the 10% rule and you can kind of start building that to your schedule. But again, week by week basis, check in with your body, see how you're feeling before you start adding on the miles. And then more as an advanced runner, someone that's been doing this for a long time or has had a lot of running schedules, a lot of miles put on the body, usually you kind of know where you like your weekly mileage to be. And what I have to remind myself a lot is it's my weekly mileage now is not what I did in college. So we were talking about this earlier, where in college, we were probably running 75 miles a week, even more, like for a 5K. And Currently, my quote unquote sweet spot would be anywhere around 50 to 55 if I'm really training for a marathon. So it's kind of funny how that changes, but usually you're able to really check in with your body and figure out what is ideally your sweet spot. And if you do want to progress from there, you need to make sure that you equip yourself with the right strength and recovery, just tools to really put into your routine to then increase mileage and make sure that you're not increasing your injury risk as well. Which brings me to my next point. Even in any stage of this, really make sure you're not forgetting the recovery and injury prevention techniques along the way. This is going to help you out the most in preventing any of those injuries. I'll talk about it on the next slide a little bit more, but doing not just building so even though there's this 10% rule, I don't want my runners to be building every single week. The body's not going to respond to that. So usually what I would recommend is more of like build for 2 to 3 weeks and then have a little bit of a deload week where you kind of go back a little bit. The body really builds confidence in that and builds the ability to really withstand all of that running mileage that you're putting on it. So that is super helpful for over time progressing your running mileage. And then of course, take care of your body. There's a lot of like modality tricks that we can do, a lot of recovery techniques that we even use in the clinic. We got foam roll, we got stretching, we got the hypervolts, which are like the massage guns. We have the Normatec in our clinic, and that is essentially, sometimes it's called elevated legs. It's those big leg things that you put all the way up to your hips and it pumps. You usually elevate your legs and it pumps like a massage type technique all the way through your legs. It's awesome. And then even like a game ready ice machine we have in our clinics, and that essentially combines compression and ice therapy to an injured area or anything that's really sore, honestly. Whole other topic for a whole other day, but proper nutrition and sleep is always good for recovery, implementing rest days, that kind of stuff. And then of course, making time for strength training. And that's where PT can really come in handy in figuring out what things are good for you specifically to really work on. But overall, you really need to build up some really good strength to increase your mileage. But blanket statement, overall, there's no magic number. There's no perfect running schedule that I can just dole out to every single runner out there. It really depends. But some themes that will stay consistent across all runners is to focus on consistency yourself. So focus on long-term planning, being patient, not pushing too much too soon, really building the strength and the confidence in your current mileage before you go on to the next one. And then above all, really listening to your body and seeing how you feel, how you recover, and how you respond to every single run that you do. So these are just a couple of running schedules I wanted to put out, stuff that I've used in the past. This is, again, it depends, and don't take this as a running schedule for you and yourself, just stuff that I've used. I wanted to illustrate a few things here. And across both, they're a little bit shorter of schedules, about 4 months for a marathon and about 3 months for a half marathon. But I'd really recommend if you have a longer period of time building up that way. But the overarching theme here is, as you can see, it's not a consistent build every single week. It's build, and then come back a little bit, or build, then come back a little bit, just so you can really get used to the mileage. And the way I personally like to think about it is focusing every week on what my long run is going to be, and then what kind of like my weekly overall mileage is going to be. Personally, I don't do well with a scripted every single day schedule. On Tuesday, the 14th, I must run 5 miles, because in all reality, you might show up for your run on Tuesday and just not be feeling it. And I don't want that extra stress to like have to push those 5 miles when I'm listening to my body's saying, I don't want to do this today. So that's the way I like to look at it. If you really focus on your long run mileage, and the weekly mileage is more just maintenance anyways, and just making sure you shake out the legs and get a little bit of extra training. But those long runs are really going to be a bulk of your training for the longer races. And then I just wanted to highlight here, we did part 1 running webinar, and we went over all of these other injuries. So if you're interested in learning about those, it's just me. I didn't have an esteemed guest on that one, unfortunately, but we talked about a lot of these, and these are a lot of the other injuries I see in the clinic. So if you want to see that, it's called Run Your Mile, and it's on our website or our YouTube channel. You can get to it from there. So just some other really good running injuries that we went over. Okay, just a quick little dive into some running resources here. So why don't you talk about your office first.
Well, for all of your sake, I hope that you don't need us and that we just see you out on the trails. But if anybody ever wants an assessment, we're right up down the way in San Marcos, and we'd be happy to see you.
Such a cool office setup too.
Surfboard.
Yeah. And then here's our clinic too. We have 3 locations in San Diego. We're in the Bressy Ranch location right here. We have one in La Costa, which is also a community of Carlsbad. And then we have one down really by San Diego State in Mission Gorge area. We offer, as a clinic, we offer free 20-minute injury screens. Anyone can come in, meet with one of us for 20 minutes as long as it's scheduled. And we can really just kind of see what's going on and see if PT would be helpful for you. We'll give you a card that either says return to the doctor, come back in a month or so if your symptoms don't improve with these exercises, or we really think PT would help you right away. So come on in and schedule an initial evaluation. Also too, I am usually the running evaluator in the clinic, but all of our PTs are equipped to look at your running form. I just really enjoy it and I really understand my runners, so usually they throw them my way. But if you would like to come in as a patient for a full evaluation, an hour with me, we're going to look at a lot of those things we talked about and really see where your injury is progressing or where it's at and what I can do to help you. But stay tuned. We are putting together more of a cash pay service where you don't necessarily have to be a patient to come in and get a full running assessment by me. And I'm really working through, should be coming soon, but we'll give you more details on that if you're interested. And really just working on, we're going to do the full treadmill analysis, recordings, reviewing the your form and reviewing any of the flexibility or strength that I really think that you need for returning to running or increasing your running. But more details on that pretty soon. And then we also have too, it's right over there. We have this Alter G treadmill in all of our clinics where basically it's an anti-gravity treadmill. You're able to get in there and I can have you run at 70% of your body weight. We call it the moon treadmill here. So it's really, really good for returning to running, even if you're not fully ready yet. And I use it as a tool for my patients to kind of start running, even if I don't clear them to run over ground yet. That way, when they get to running over ground, they're not absolutely fatigued cardiovascularly. So it's a really, really useful tool for that. And then I just wanted to throw out some local running meetups. I know you've been to the Pizza Port one a few times,
Didn't
right?
make it, but
Yeah.
I'm looking forward to it.
Yes. So that one's really good. I've heard really good things about the Panikin runner group. They have a really good following. I'm going to make that's my go-to next. On Saturday mornings, they run along the beach on PCH, but these are just some really good local meetups, completely free, lots of runners out there, and they have a good time.
The Sunday one at McGee is supposed to be very family friendly.
Oh.
I think a lot of people bring their strollers out.
That's really cool. Good to know. Lots of different times. Personally, I go for the morning ones, but there's some evening ones there too. And then just some races coming up in the local area. I'm doing the holiday half December 17th. I'm going to drag my husband out there too. We'll see if he makes it. Any races that you have coming up?
My husband and I are both doing America's Finest City.
Oh, which is at the end of the summer, right?
August, yeah.
Oh my goodness.
And
Yeah,
then hopefully a Carlsbad Marathon again in January.
awesome. That's so exciting. August 21st. Yeah, I have that written down right there. How funny. Very, very cool. All really great races. I've done my favorites for a marathon is the Surf City up in Huntington, but it's a little bit of a drive.
It's early.
Yeah. And it's super early in the morning. Do you want to say anything about the sled? This is such a cute sled.
Just good luck on your return. This was my first half marathon back after the babies were born. They actually both ran it in utero the year before and the 2 years prior.
Oh my God, that's amazing. Very, very cool. And then on the right, it's just the half marathon that I did drag my husband to, and I played a round of golf with him later on. So that was the deal. So that was my kind of return to running last year, but we're really looking forward to getting back into our own running journeys coming up soon. Okay, just some references on all of our slides here. And then I wanted to just point out that we're going to do a webinar. The topic is going to be cardiovascular fitness and exercise guidelines, and that's our next longevity webinar. Tentative date right now is Saturday, August 27th, same time, 10 to 11. But more details to come on our website, and it'll be by our personal trainer and health coach that operates out of the San Diego office in Mission Gorge, Lily Pentlin. And we're really excited to have another topic coming soon. And then Annette, I will bring it back to you for some questions. That's it from us on the presentation side.
Thank you so much. Let's see here. So now that ends the presentation and we'll stop recording and open up for questions and answers. So we're going to stop recording.